For some perspective on this, I'm joined by Regina's Police Chief, Evan Bray. Thanks for being here.
Thanks for having me, Sam.
We knew going through this year that drug overdose deaths would likely be worse than they were last year, but is there any sign of things turning around?
Well, I think I'm going to say hopefully. I think what I can say to that is there's aggressive work being done in some strategies to try and better coordinate services. There's aggressive work and dialogue happening around harm reduction. And harm reduction isn't something that I don't think our community and even our province has had a lot of experience with, but understanding the complexities around this drug problem, harm reduction is an essential part of it. And so there's a lot of things that are going on. Some of them are longer term, some are more immediate and short term, but I feel like there is momentum, and I'm going to remain hopeful that we are headed in the right direction.
You mentioned harm reduction. What role do supervised consumption sites have in preventing overdose deaths? Anecdotally, what can you tell me about how it's played out in Regina?
Yeah, I think we're early into that venture in Regina. It's only been in the last few months that we've seen them here. And so even the uptake probably isn't what we would like. We would like to see more people using those, understanding that harm reduction sites are really a way to prevent serious injury and death while we try and dig into and find solutions to the bigger problem. It's not the solution to the problem. It buys us time. It saves lives. It's an intermediate step to an immediate problem with an immediate response that gives us the ability to do some longer term work. So, I can tell you from a police perspective, a decade ago, you probably wouldn't have had police talking favorably about harm reduction. Yet today, I'm shouting from the rooftops that this has to be part of an overall strategy. And so we work very closely with, for example, in Regina, the Friendship Center, AIDS Program South Saskatchewan, and any other rollout of naloxone kits that happen from community-based organizations. All of those little pieces go a long way to saving lives.
The coroner's report goes back to 2010, and over the decade, you can really see how many more drugs have become an issue. How does that affect policing strategy?
Yeah, I mean, the type of drug brings a different complexity with it. And so if I just use kind of our two most recent prevalent examples, methamphetamine in our community was a huge problem from 2016 to 2020. And in that time, we saw crime spikes that were through the roof. And that was very consistent across the province. Just the type of drug that it was and the effect that it was having on people were causing them to engage in high risk activities and many times either commit crime or be victims of crime. Whereas fentanyl, which is predominantly the challenges that we're having right now revolve around fentanyl, it is very much a health related problem, challenge, and danger. And so people that are using drugs today that have fentanyl or derivatives of that in it are finding themselves at risk to die. And so it's not that there isn't crime being committed and that the drug world still poses that same danger to our community, but the people consuming the drugs, the people that suffer with addiction, not the people that benefit from the sale of the drugs, the people that actually have a substance use disorder are at a high risk of dying as a result of the consumption of those drugs.
Thank you so much for your perspective and information, Chief Bray.
Thank you very much.